So the last thing that we're going to do is an apical pulse. And an apical pulse really does take quite a bit of practice. So you're going to need to find the point of maximum intensity, or the PMI of the heart, which is at the apex of the heart. So you're going to want to make sure that you find that first, and that can be kind of tricky. So the more time you practice doing this, the easier it will be for you. So continue to practice on family, continue to practice on your significant others, continue to practice in fundamentals, and it soon will become very easy for you. So the first thing that you need to do is you need to do your AIDIT, your identifiers, and you need to wash your hands. And I've already done that in my first skill video, which is blood pressure. So you can refer back to that if you want to remember how to do that. So I'm going to go right into the skill. And I think it would be beneficial for you at this point to put on some gloves. So we can say that I've put on my gloves, and I'm going to let this patient know that I'm going to uncover her top half for a few seconds while I find the 5th intercostal space. That's the easiest way for you to do it. So you need to identify what side of the bed you're on. In this particular case, I'm on the right side of the patient's bed. But I know that the heart tips on the patient's left. So I know that's where I'm going to be placing my stethoscope, on the left side of her chest. So it's always important for you to think about that first, as we sometimes can get anatomical position confused with the way our body's positioned versus the way the patient's body's positioned. Remember, the heart tips to the left, so you should be hearing that on the left side. You won't hear, or you'll hear muffled heart sounds on the right. So I'm going to first say, hello, Miss Potts. I'm going to go ahead, I'm going to pull this gown down here, but maintaining your modesty here, I'm just going to cover you up a little bit. So this will allow me to go ahead and keep her nice and covered, but then I can pull the gown down. So I'm going to pull this gown down, okay? And certainly tell your patient what you're doing. Say you're looking for, you want to listen to her heart, and you're looking for a particular space that will help you hear it the best. Don't get into medical jargon with the patient, like I have to find the mid-clavicular space, because the patient won't know what you're talking about. So I just want to hear your heart, so I'm trying to find the space that's going to give me the loudest sound. You're going to start at the clavicle bones here, and you're going to go ahead and you're going to feel in between there. Now, this is a mannequin, so it's hard for me to show that to you, but Ms. Blackmore didn't want to pull down her shirt to show you this. So you're going to first feel for that clavicle bone, and then right between that clavicle bone and the first rib is going to be your intercostal space. So you're going to feel that space, and it will feel kind of spongy as opposed to the actual bone, which will feel hard. And then this is a good marker for you to put your second finger on, and then take your pointer finger, follow over that bone, and find that second intercostal space. And then again, you're going to move that second finger. I'm going to go ahead and put her up a little bit so that you can see a little bit better. And she has no ribs, so this does make it a little bit tricky. But I'm going to go ahead and take my second finger here, and I'm going to move it down in that second space, leaving my first finger able to feel again for the bone and that intercostal space there. Remember, the bone is hard, and the space is a little bit more spongy. So now I'm at the third space, and I'm going to go ahead and take my second finger there and slide that down into the third space. So I'm keeping my spot. And then I'm able to find the fourth intercostal space. Again, I'm going to take my finger, put my finger there, and I'm going to feel for my 5th intercostal space. Now remember, everybody has different anatomy, so that space might not be the same for everybody. But typically it's going to be right about here at the nipple line or slightly below the nipple line. So for her, it's right about here. So the next thing that I need to do is I need to position my stethoscope mid-clavicular. And what that means is in the middle of the clavicle bone, which is right here. So the middle of the clavicle bone would be right here. So you can see here how we kind of line up very nicely, usually with the nipple. So we're going to end up just slightly below the breast. In most cases, you may have to have women pull up their breast tissue, as it can be very hard to hear over that breast tissue. So you may actually have to have them hold that tissue up. Then you're going to put your stethoscope, remember ears are facing out. You're going to put your stethoscope on the appropriate spot. And in this case, I'm going to keep her covered and go from underneath here. And I know this is really low, but it's just because I can't move her breast tissue, but it would be up a little bit higher. And then I would go ahead and I would listen. And I want to make sure that I listen for 1 full minute. Just like with the peripheral pulse, I want to be able to really listen for any rhythm problems, so irregularities. I also want to get that rate, but another great opportunity for me is, as opposed to feeling or palpating, I'm now able to hear the heart sounds. So I'm able to hear if there's any abnormal heart sounds or unusual heart sounds, clicking, grinding, swooshing, anything that wouldn't sound normal. So for you to first understand what's not normal, you need to understand what normal is. So go ahead and practice on your family members again, listening to those sounds, hearing what's normal, what normal sounds like. That way, when you're in the clinical arena, you'll be able to pick up on those unusual or abnormal heart sounds. So a normal apical pulse, again, is going to run 60 to 100. You shouldn't have very much of a discrepancy between the apical pulse and the peripheral pulse. If there is a large discrepancy between the two, you need to go ahead and redo it to make sure that those are accurate readings that you've got. And then if there is still a discrepancy, it needs to be reported as it can indicate vascular issues. So go ahead and chart that number down. Make sure that everybody knows that was an apical pulse. This is going to be an extremely important procedure for you to perform before certain medications are administered. So it's important that you get the stethoscope in the most appropriate spot or the point of maximum intensity. Thank you.